is things to consider for your infant for their health and care. Okay. When a woman becomes a mother, she naturally does not think about all the precautions and medical care her newborn will need throughout their first year. In order for a new mother to be aware of these things, we must inform her of 5 important issues.
You remember my instructions regarding health?
Okay. SIDS, which is sudden infant death syndrome, vaccinations, benefits of breast milk, nurturing physical touch, and the importance of umbilical cord care.
You're wearing your gun, you're outside.
Okay, first, sudden infant death syndrome.
I'm ready for you.
What it is, I don't know if you guys know what that is. It's sometimes when a baby goes to sleep, they don't wake up, and people really don't know what the cause is, but they have some reasons that they think of it. They say that positions of sleeping have seemed to be caused in SIDS, like prone sleeping, which is sleeping on the stomach, which is not okay. Infants sleeping alone in a crib or mainly found prone or on the side position among soft bedding. So they're saying that if you sleep on your stomach or your side in a soft bedding, it could cause SIDS for a baby. And they say that sleeping on the back is more better and can help reduce SIDS.
Where do you think you're in the
Oh, and not sharing a bed with anybody, so it's better to keep the baby in the crib alone. The final infant mortality rate in the United States for 2008 was 6.61 infant deaths per 1,000 live births. Sudden infant death syndrome is the 3rd leading cause of infant death in the year 2008 and is the 1st leading cause of death among infants ages 1 through 12 months. A total of 2,353 SIDS deaths occurred in 2008. Although the exact cause of SIDS is unknown, some risk factors have been identified. They include being born prematurely or at a very low birth weight. The earlier a baby is born, the higher his risk of SIDS is. Being born to a mother under the age of 20, teen moms are most likely going to have a child die of SIDS. Having a lot of siblings, especially if they are close in age, the risk of SIDS increases with each baby you have. Also, the shorter the time between a woman's pregnancy, the higher her baby's risk of SIDS. Certain ethnic backgrounds show high rates in SIDS. The highest are for African Americans and American Indians, and lowest for Asians and Hispanics. The rates of SIDS among African Americans, American Indians, and Alaska Natives are more than double that of Caucasian infants. Being a boy causes also to have more risk of having SIDS. An infant should get vaccinated on a regular basis. Though some children do suffer from mild reactions from these vaccinations, very few become seriously ill, and any pediatrician will reassure you the benefits of having these vaccinations. There are 10 vaccinations recommended for an infant to receive within his or her first year. Hepatitis B they will get it at birth, and what it does is it protects your child against the virus of hepatitis B, which can lead to liver damage and even death. They also get it at 1 to 2 months, and that's about it. Oh, and they get it at 6 to 18 months. DTaP, which is a vaccine that protects your child against 3 diseases: diphtheria, tetanus, and pertussis, which is the whooping cough, and they get that 5 times. Then HIV, which protects your child against a severe bacterial infection that mostly affects babies and children under 5 years old, and they get that 4 times. Polio, which prevents polio. I can't say this one, but it's TCV, and what it does is it protects against pneumococcal infections, which mostly strike children under age 5 and can lead to some of the worst childhood diseases. Rotavirus, which is 3 doses, and it helps protect against rotavirus, the leading cause of severe diarrhea in babies and young children around the world. And the flu shot. and the measles shot, which prevents measles.
Well, it sounds fun.
And varicella, which prevents chickenpox. Oh, and hepatitis A, which prevents hepatitis A.
Well, I guess you're right.
Okay.
I ain't gonna argue about it.
Now the benefits of breast milk. Some mothers prefer formula over breast milk because they are not aware of the importance of breast milk. Breast milk has many positive outcomes. It helps the infant grow. It is easier to digest and it helps fight diseases. Some studies have demonstrated an important health benefit of breastfeeding. Breastfeeding children are more resistant to diseases and infection early in life than formula-fed children. Breastfed children are less likely to contract a number of diseases later in life, including juvenile diabetes, multiple sclerosis, heart disease, and cancer before the age of 15. Mothers who breastfed are less likely to develop osteoporosis later in life, are able to lose weight, gain during pregnancy, and more easily, and have a lower risk of breast irritant and ovarian cancer. Breastfeeding also has an economic advantage. It's cheaper than buying formula, and it helps avoid medical bills later because it helps equip the baby to fight off diseases and infections. A study by researchers were done to see the results of breast milk and infants' weight gain and height, and they saw that the babies who were breastfed actually gained more weight and actually got taller than babies that were formula-fed. Breast milk has just the right amount of fat, sugar, water, and protein to help an infant continue to grow. It is a thinner type of milk than colostrum, but it provides all the nutrients and antibodies an infant needs. The cells, hormones, and antibodies in breast milk protect infants from illness. Formula-fed infants also have higher risk of diseases, lower respiratory infections, asthma, obesity, type 2 diabetes. Some research shows that breastfeeding can also reduce the risk of type 1 diabetes, childhood leukemia, and atopic dermatitis, which is the skin rash on the skin. Breastfeeding has also been shown to lower the risk of SIDS. Nurturing physical touch. Do you guys know that? It's just, when the mom holds the baby and just loves it. Babies are born with the urgent, intense needs and depend completely on others to meet them. Nurturing touch helps the baby's needs for physical contact, affection, security, stimulation, and movement. Parents who choose a nurturing approach to physical interactions with their children promote development of healthy attachments. Nurturing touch stimulates growth, promoting hormones, improves intellectual and motor development, and helps regulate baby's temperature, heart rate, and sleep wake patterns. Infants who receive nurturing touch gain weight faster, nurse better, cry less, are calmer, and have better intellectual and motor development. Studies have shown the importance of nurturing touch. These researchers did a study on premature babies, and they showed that the ones that had more nurturing touch actually got out of the hospital better than the ones that didn't. Umbilical cord care. After an infant is born, the umbilical cord is clamped and cut loose to the body, leaving an umbilical stump. The stump should be well taken care of to avoid infection. About 10 to 21 days, the stump will dry up and fall off, leaving a small wound that may take a few days to heal. What you should know is that it must be kept in clean. You should fold the infant's diaper below the stump so it's exposed to the air and not to the urine. When the stump falls off, you may detect a little blood on the diaper, which is normal. You should avoid giving the infant tub bath until the stump falls off. You should always be informed that you should not force or pick at the stump, that it should fall on its own. It should not be pulled off even if there is a small piece remaining. This can cause an infection and bleeding. There have been different studies showing how to clean the umbilical cord, and they say the safest way is to leave it open. A mother is not always well educated on these topics when her baby is born. That's why it's important to inform her on these 5 topics: sudden infant death syndrome, vaccinations, breast milk, nurturing physical touch, and the care of an umbilical cord. These 5 things will not only make the first year of motherhood easier, but it will also aware the mother and benefit the infant as well. Good.